Proudly Media. Thank you for being here. Please subscribe to our channel. We have over 1,000 videos covering every sphere, every occasion. If you watch our videos, there's a lot you can gain. And we find out that a lot of people are able to reach their loved ones by watching our video. Our primary objective is to get you the best. We do live streaming, we do videos, we have drones, we cover events, basically to bring the best to you. That's what we do at Proudly Media. In social media, we need the numbers. So please, anytime you visit our channel, just kindly subscribe. It is free. Thank you once again for coming to Proudly Media.
Your Royal Majesty, distinguished chiefs and council members, esteemed guests, ladies and gentlemen, it is with deep respect and a profound sense of honor that I welcome His Royal Majesty, the Asaba of Asaba, to Asaba Specialist Hospital.
It is in the line of duty because healthcare is a significant aspect of the welfare of a people, and that is an aspect that we are not taking for granted. Firstly is for me to commend the government of the day and successive governments for making this place possible. We are happy for what we have seen. We looked at the faces of the people working here and see that they are happy. That is good enough for a working environment. But for people to come, they must be accorded that right of dignity as human beings and be accorded the respect that they deserve. Treat them like human beings and not like animals. And that is a special plea to the nurses and other members of staff.
I was actually coming up to speak as a patient of this hospital. And yes, I have been patient of this hospital a couple of times. And I want to specially thank Dr. Peace for the attention she gave me all the time I came here. And that was what I was coming to do actually. And to thank the staff too.
We are now more than a specialist hospital. And I believe very soon, the Nigerians will be coming to us from the other state that what is the model we are using as a specialist hospital to make us thrive this faster. Just in less than 5 years, we're having two schools using us as a teaching hospital.
It's okay. Wait.
So from here, I was put to theater and ask you. And that's
Thank you.
All our patients are required
No. Please be seated. No. Asaba here to bless this occasion, especially our royal father, Asaba Epiphany Chigbogu Azinge, Order of Niger, fellow of the Total Institute of Mediators and Conciliators, fellow Nigerian Institute of Advanced Legal Studies, an institute he commanded at the height of affairs as Director General and Chief Narrative of that institute. The recipient of the prestigious Kwame Nkrumah Leadership Award, listed in Who is Who in Africa for the past 20 years. Also listed as Who in Nigeria for the past 25 years. And of course, a member of Body of Benchers, a body of men and women, very distinction in legal practice and character. The only African who has occupied the position of the Judge of the Commonwealth Arbitral Court. And of course, only African have become the president of that court in the history of the court. I'm talking about Commonwealth Court of Arbitration. A knight of St. John's International of St. Croix the Great. A graduate of law 45 years ago. A professor of law 25 years ago. Honored in 1980 by the then President Shehu Shagari as the best youth copper in then Gongola State. Put your hands together for our royal father. His honor started quite early. He had written several books. One of the books he wrote about himself, Born to Serve, chronicle his antecedents and work for this country for the past 45 years. Special advisor to the 3 attorneys general of this federation. The men who have distinguished himself and love education and rule of law. He has established several universities, notably amongst them is National State University and President's University Abuja. And each university, he has set up faculty of law. Our royal father remains one of the founding fathers of the University of Nigeria and the University of Benin Law Faculty. And of course, I'm able to say he attended London School of Economics and Political Science for his PhD and Master's degree. The man who was honored with the Wakil of Bahara. That's the great thinker and philosopher by the Asaba of Bahara. He became the President General
of Asaba Development Union worldwide. Asaba people spoke with one voice, 94.6%, and said, "Come, instrumentality of Almighty." November 2024. And on the 28th of October, on November 2024, His Royal Majesty was given the staff of office by none other than the Right Honorable Sheriff, Elder Sheriff Oborori, the Governor of the Delta State, as the 14th Asaba of Ahaba. Royal Mother is a law of immense repute. And they are blessed with children. Almost all of them are lawyers. And the way I see the grandchildren, they are going to be lawyers too. He has lovely twins and are doing well. And one of them, I see the traces of the grandfather in him. He's going to be a senior advocate of Nigeria. And a body of benchers too. So I'll put our hands together for our royal father. Since our royal father became the Asaba of Asaba, he has changed the narrative of traditional governance in this country. And I'm not going to tell you, Our Royal Majesty, Honorable Adadebema. And I, at this point in time, introduce Oboshi Nabo, Chief Victor Musa, Amulika of Ahaba, to greet our royal father. He's a senior special advisor to our Royal Majesty. Next. Next is Oboshi Engineer Yobumodi to greet His Royal Majesty. Barrister Majesty, Elder Sheriff Oborori, Governor of Delta State. We greet His Royal Majesty.
Dr. Isoji, we do the introduction of the top management. Yes, sir.
Dr. Peace Iwosa Ayeriorisha. Next to her is my humble self, Dr. Isoji Daniel, Director of Clinical Services and Training and Chairman Medical Advisory Committee. Next is Mr. Ijoma Mogolu, is the Director of Administration. Next is the Director of Finance, ably represented by Mr. Frank Omasho. Then we have very senior consultant here, Dr. Odidi Olarewaju. He's one of the pioneer consultants here, and a very senior consultant radiologist. We have Dr. Agomo Truth, consultant radiologist. Then we have the chairman of Medical and Dental Consultants Association of Nigeria, MDCA, Dr. Oke Obada Serai. The secretary is also seated, Dr. Harrison Ejiere, consultant public physician. We have our chief ophthalmologist, Dr. Nwamboshi Edith. She is the head of ophthalmology.
Asaba
Dr. Urima Okiaba, the head of Family Medicine Department. Then the HOD of Nursing Services, Ms. Usenu Heriata. We have many other heads of department seated behind them, and also representative of the Association of Resident Doctors, so we are represented for want of time.
Dr. Konta, there's something about the Kontas. Almost everyone is a medical doctor in the family. Thank you.
On behalf of the management President is called and document
Namago, Asaba Habago,
Namago, Obiwe, Rizelayan, Operation, Honorable, Chief Medical Director and team. Namago si Mugano, Naona Batago, if you know Butara. I say, Kangano, Unemeka, Una Loka. Achuga doesn't know na ask na gani ho na delta state na gani ho na haba kabu ebe a na-eji na-atụ ọnụ efecha ka o si na ya n'aka Chineke dịwe na anyị
anyị abụọ ji anyị ga-adị ahụ dị mma ezinụlọ anyị ga-adị mma mmụọ anyị ga-aba anyị ihe na-alụ ọrụ n'ọrụ a ife ọma ga-elu n'aka ihu n'ihu ka unu ga-na-alụ unu ga-adị mma ọ ga-abawanye ahụ ndị unu na-azọkwa n'ebe ahụ ga-adịwa ahụ wabatawa ga-agbakede ọsịsọ anyị ahara ga-adị mma udo ga-achị na be anyị udo ga-achịkwa na delta steeti niile ife ọma ga-elu anyị aka ife niile dị mma anyị bụ n'obi Chukwu ga-emezula anyị nkata anyị ga-akpakwata atọ ọ ga-abala anyị ebele anyị ga-atọ ọjị atata wele n'afa Kraịst bụ onye nwanyị. Ọjị ka anyị kwụ na mmanya ka anyị ga-adị
Chief Medical Director of Asaba Specialist Hospital on the occasion of the visit of His Majesty, His Royal Majesty, the Asaba of Asaba. Your Royal Majesty, Your Royal Majesty, distinguished chiefs and council members, esteemed guests, ladies and gentlemen. It is with deep respect and a profound sense of honor that I welcome His Royal Majesty, the Asaba of Asaba, to Asaba Specialist Hospital. Your Majesty's presence here is both historic and inspiring. between the traditional institution and modern healthcare. I will give a brief on the growth of Asaba Specialist Hospital. When I assumed leadership of this facility, it was just 9 months old in 2019. Then ASH was a promising facility, still finding its footing with just about 40 staff. Today, by the grace of God and the unwavering support of the previous governor and the present, His Excellency the Governor of Delta State, Governor Sheriff Uborewori, the commitment of our dedicated staff, and the support of the traditional institution in the land where we operate, ASH has grown into one specialist hospital in Delta State and Nigeria at large. From just about 40 persons or 50 when we started the hospital, it has grown to a staff strength of over 700 and 230 beds and a monthly admission rate of about 1,000 average and a monthly clinic attendance rate of about 10,000 patients on outpatient basis. When you compare to where we were at the time we started, we've made a very huge leap forward in the short space of time that we've operated. I think the first year we operated, we saw a total of about 3,000 patients throughout the whole year. So now we see about 10,000 monthly. It's a very significant difference. In line with the policy of the state government, we conduct free deliveries for pregnant women, and monthly delivery rates are about 200, has been increasing as the years progress. 800 pregnant women weekly, and a lot of them give birth here free of charge, thanks to the state government. The hospital boasts of 230 beds. It has a pre-suite theatre complex and 2 additional theatre suites in the labor ward maternity complex. Recently, the state government was gracious enough to establish a 3-unit dialysis center with modern water treatment facilities. And we have also improved on our asset and emergency department. We have expanded our diagnostic services. Currently, the laboratory boasts of very high-end investigations, cancer markers, cardiac markers, and we also have facilities for production of blood products, including platelets and fresh frozen plasma, which is ASH is the only hospital that does that in Delta State. The hospital also has a very well-equipped sickle cell center that has facilities to do newborn screening for genotype. So every child born here gets the opportunity to have their genotype known at birth, which has helped to reduce the morbidity and mortality associated with sickle cell anemia, which is a very common and debilitating illness in our environment. Again, we have grown from just a general hospital, mainly service-oriented, into a teaching hospital standard center. We now run accredited residency training programs in various faculties, including pediatrics, which is my department. Charity begins at home, so we stay with my department. So we have accreditation from both colleges in pediatrics, obstetrics and gynecology, radiology, and family medicine. We are working on getting more accreditations in other faculties too. Again, we train interns, nurses, pharmacists, and medical doctors too. The hospital recently attained its teaching hospital status, as we have now entered into a memorandum of understanding with the Asagba University to serve as a teaching hospital facility for their medical school, which is something that has given us an immense sense of pride and pleasure to be able to be well positioned to provide that service to the school. We pioneered a cashless payment system. The hospital is the only hospital in the state that operates a cashless system, and we've been doing this for over a year now. And this has significantly helped to boost our internally generated revenue. The hospital serves as a referral center, not just for Delta State, but for other neighboring states, including Anambra, Edo, Bayelsa, and Rivers. Our partnerships with universities, NGOs, and international organizations has helped to improve patient care and reduce morbidity whilst projecting the hospital on a broader scale and having people know what we do in ASH. Recently, we were able to produce a fellow who is now a consultant pediatrician as been appointed by the hospital from our own residency training program. Your Majesty, this hospital stands as a testament to what is possible when government, community, and traditional authority work hand in hand. We humbly seek your continued support in mobilizing our people for early hospital care, health insurance enrollment under the state government health insurance scheme, and preventive health practices including immunization and regular health checks. As a facility, we offer regular health checks annually free of charge to all staff of the hospital. So I think this year we screened over 200 persons who have availed themselves free of charge. All and a holistic check from dental to blood checks, ECG, and the works, and even eye checks too. So we see that the uptake is still not as good as it ought to be. But a facility with over 700 persons, we had just about 200 and something people who availed themselves of the free annual check. So there's need for more awareness of preventive health care because medicine is moving away from curative to more preventive. Together, we can reduce disease burden and strengthen the well-being of our people. As a growing facility, we have numerous needs, and we have been enjoying the very generous support of His Excellency, the Governor of the state. We're very happy to have you here today, and we believe that with your presence, Asaba indigenes and even those beyond who benefit from the services we offer here, become more aware of what we do, and be able to support us in whatever way they can possibly support. Because the hospital needs more support. We have need for expansion. We have need for numerous things actually. We have need for, okay, the government has graciously approved an MRI machine for us, which will be supplied soon. Our CT scan is done. We have it for a CT scan machine. And many other things which I will not mention. Let me know what the news. We pray for your long life, good health, and the prosperity of the Asaba Kingdom. Thank you, and God bless you, sir. Unagu, unagu, unagu.
You will agree with me that she needs. Thank you very much.
But we are dedicated ensuring that we deliver quality health care. And the management have been doing that. And I would like to commend the CMD.
But from my observations so far, I noticed that this facility has been of tremendous benefit to our people and even the strangers living amongst us. However, I equally noticed that amongst their staff strength, our people are not adequately represented. I don't know what the processes are for employment, but amongst the over 700 staff strength that we have, we don't have, I'm not sure we have up to 30 people from Asaba amongst them. I don't know. So I want to use this opportunity to plead with the management to find a way to assist our people too with work opportunity.
Member representing Oshibili South constituency in the Delta State House of Assembly. Honorable.
Obigwe, ndị olizele, Igwe Shinabon, Igwe Igwe, the CMD, and members of the Asaba Specialist Hospital. Thank you for this meeting. Thank you very much.
Thank you very much.
5 years ago, when he personally led a team of, I suppose, friends and people of like minds to the hospital during one of the festive periods, as Christmas period. And he personally went around the patients in the maternity home where I'm head of the department and made gifts, presented gifts to the mothers and the newborn babies. It was a joyous occasion. And this is not anywhere. We went round to other wards and made presentation. And for want of time, also left a packs of gifts to be given to other patients. So when the news came that His Royal Majesty had laid the Asagba, it was a joyous and happy moment for us. Namago, Odigwe, Namago.
Thank you very much. Kindness, goodness.
Right Honorable Ngozi Okode, Honorable Bridget Anyafolo, not forgetting Barrister Ikemadu Emezie. Yo wish no. Dear CMD, members of the management team, staff of Asaba Specialist Hospital, let me warmly appreciate you all for the honor accorded us today to be here to engage with all of you. It is in the line of duty because healthcare is a significant aspect of the welfare of a people, and that is an aspect that we are not taking for granted. Not too long ago, I undertook a tour of all the primary healthcare centers in Asaba. Just last week, I was at the Federal Medical Center for similar engagement. And today, I'm happy that I'm here to listen to you, to engage with you, to see things for myself, to listen to your challenges, and to make some informed comments about the state of this institution. Firstly is for me to commend the government of the day and successive governments for making this place possible and for supporting it to grow the way and manner it has grown within the shortest possible time. Commend the government for the numerous support to the mothers, the free delivery facility, and all the numerous equipment that is available here, dialysis machine, and so on and so forth. And of course, the promise of the MRI, which we all know how expensive it can be. Because presently, we are trying to see how we can source one for the Federal Medical Center, and I know it runs into the neighborhood of about $300,000, which with a generous conversion comes to almost 450 million naira. So we are happy that government has been quite supportive, spending this amount of money. And you also, you have done well in your own. I was pleasantly pleased to go on a tour, and I saw all the equipment in the facility. And I've also listened to the CMD, the giant strides we've made from 2019 to date, the exponential rise in the number of patients within this period and on a monthly basis, as the case may be. Quite commendable and worthy of admiration. So please, a round of applause to yourself. But I also want to commend the personnel in particular. Both the doctors, the nurses, and all the other personnel of this place. That you have remained steadfastly committed to this place is something that we cannot take for granted. A good number of you may have reasons to leave the shores of this country, but you have remained resolutely committed to the healthcare system, not just here, but in the whole of the country. And the most impressive aspect of what you do is that you have migrated from just a general hospital, a specialist hospital, to almost a teaching hospital today. The accreditations you have received in diverse areas eminently puts you in a position to be a teaching hospital in your own right. So one major plea I am here to make is to Delta State government. And I believe the message will resonate clearly by the time we leave here. And my plea to the government of the day is that they should put the machinery in motion to make sure that in the shortest possible time, Asaba Specialist Hospital is elevated to a teaching hospital. For us, you have the personnel, you have the facility, you have what it takes. You're already accredited in many ways. So what it is left is just in nomenclature. It will help in many ways than one. It will help in building up the capacity of staff. It will also help in more employment opportunities. It will more importantly keep the staff here longer than necessary. Because once you migrate into a teaching hospital, automatically the university conditions will apply to you. And certainly the retirement age will change automatically. And people will not be living here at 60 or thereabout. When you get to the professorial cadre, you will now be retiring at 70. That will keep people here for a longer period. And that is the kind of thing that we look forward to. But having said that, we know, as has been mentioned by my friend, the consultant orthopedic surgeon, it must go through the crucible of law. There must be legal instruments to support it. And we are happy that the member representing Oshimili South in the House of Assembly, Honorable Bridget Anyafule, is here with us. And I want to charge her, please let us work together to see how we can migrate from Asaba Specialist Hospital to either Asaba Specialist Teaching Hospital or to Derrick's or Sadebe University Teaching Hospital, Asaba. If we're able to do that, I believe that it will help in a very special way to elevate the status of both the hospital itself and those that work in it. So we are happy for what we have seen. We looked at the faces of the people working here and see that they are happy. That is good enough for a working environment. It doesn't in any way suggest that all is well. Much more can still be achieved. I know that the member representing Anyocho Oshimili in the House of Representatives, Right Honorable Ngozi Okoli, will want to say something. And I want him to speak after me. I don't mind if it is breach of protocol, but I'll permit him to do so. And I want you to listen to him, because I know fully well that he will not leave the place without making a firm commitment of a constituency project that he will want to initiate with. That is the much we can do. Well, on another note, it is something that I've tried to look into, but I've noted that and noticed that it is not under my purview at all. It is not something, as a traditional ruler, I can handle. Indeed, I've asked questions all over, and I've noted that it is something that only the House of Assembly can legislate upon, not within the purview of the traditional institution. I am aware that a member of the House of Assembly is already pushing along that line. And the person, Mrs. Marilyn Daramola Okowa, the daughter of the immediate past governor, is already pushing along that line. And that is what it's supposed to be. And we are hoping that with the support of our own Honorable Bridget Anyafulu, if they can fast track whatever they are doing, it will change the narrative of the whole issue of rent and agency fee and what have you operating in Asaba. So it is not an oversight on our part. It's just that it is not within our purview. If it's something within my purview, I would have long addressed it. So, but we are hopeful that it can still be handled by the House of Assembly, and we want to urge us to do so. Having said that, I want to say how pleased we are with the warm reception accorded us. Please, the emphasis on the personnel. Take care of yourselves and follow keenly what obtains in many other places. I monitor what goes on at the National Hospital Abuja every now and then, and in other places. I've heard of exhaustion on the part of the personnel, some of them slopping, dying in the process. I will appeal to you to take care of yourself and make sure that you moderate things. And for you to be seeing almost 10,000 patients on a monthly basis is quite enormous. And it is something can drive people to the limits. But having said that, I also have to repeat what I said at FMC. And this is special plea to the nurses. The record of the nurses-patient relationship is not too good. Patients complain so bitterly that there is no empathy or sympathy demonstrated by nurses to patients. I believe that that is an area that the CMD and management team will also want to look into. If there is need to retrain your nurses along this line, please do so. Nobody who is well will want to come to hospital. Nobody who is well wants to come to hospital. But for people to come, they must be accorded that right of dignity as human beings and be accorded the respect that they deserve. Treat them like human beings and not like animals. And that is a special plea to the nurses and other members of staff. But having said that, I want to thank you. We will continue to engage with you. We have said it repeatedly that we are happy with you and we are not going to abandon this place at all. Our prayer is that God will touch the state government to continue along the line they've gone, to continue to support this place. And on our part, we will also see how we can use the instrumentality of our own sons and daughters, starting with Right Honorable Ngozi Okolie today. And having finished with him, we can now see all the other sons and daughters that can key behind him or queue behind him and see what they can do to support this place. So that in the fullness of time, when we lay claim to this place, it will not just be verbal, it is going to be by action.
Honorable Member, CMD, distinguished ladies and gentlemen, good afternoon. I was actually coming up to speak as a patient of this hospital. And yes, I have been patient of this hospital a couple of times, and I want to specially thank Dr. Peace for the attention she gave me all the time I came here. And that was what I was coming to do actually, and to thank the staff too for all their attention anytime we come here. In fact, I advertise this hospital outside as the best hospital in Asaba, and I pray you guys keep it up. But since our royal father has put another thing in my assignment, if it's an assignment, I will liaise with you to see what we can do for the hospital. Already, we are trying to build a rehabilitation center for Asaba. But if you don't, hopefully, when it's complete. Thank you so very much. Nago.
The standard estate protocol, Corporate Protocol Auditor. It's very good to see you here, Your Majesty. Always a nice thing in your presence. Thank you for gracing our humble hospital. From, like Randy said, from the little general hospital, we are now more than a specialist hospital. And I believe very soon, Nigeria will be coming to ask from the other state that what is the model we are using as a specialist hospital to make us thrive this faster. Just in less than 5 years, we're having two schools using us as a teaching hospital. And that is a great news for us. Thanks to our able CMD, who is always does not sleep, tirelessly working to ensure these tribes are getting better. And I believe with your coming here today, it will partner with us more. It will also send a message to the environs, the nearby villages, that of a good thing, we're doing a great work here. We've gotten the advice we've gotten given to us. Of course, we'll work on that. We're humans. We're overwhelming sometimes. But I believe we can do better and give the best so that here can, instead of you going abroad to run for medical health care, you can gladly say, let me go to Asaba Specialist Hospital, and with a warm smile, the nurses, the doctors, the healthcare assistants will all embrace you, and by the time you're leaving here after your discharge, you're going home smiling very well that yes, I got the best care. That is achievable. It's done elsewhere in the world. We can actually achieve that here in Asaba, here in Delta State. So, Unago will say thank you very much for coming to us. Thank you for bringing your fatherly blessings. Thank you for making here your home. Of course, we are tender to you here. Thank you for making here your home. I'm also making a request on behalf of the resident doctors. I'm the vice president. My president is not here today. He's in our AGM in Castina right now. We're making a request for you to be our patron of our humble association. We're still a growing place. We're just we're a year plus old, so we're still a growing association. Of course, we're the most peaceful resident doctors in Nigeria. We're the most peaceful. We've not gone on strike. Even the strike that just happened some days ago. We have, in fact, it's facing the sanction over the Castina right now for us not going on the strike. But we said the state government has paid us the money, and we care for people of Asaba. Yes, of course, we care for them. We decided not to go for the strike. We decided to work, and there was no strike for the 48 hours here. Thanks to my doctors and nurses that were supportive of our government who took this action. So we're appealing to you to be our patron of our home police association. We know that in the next coming years, we are going to be great everywhere. Thank you very much for coming, sir. Thank you, CMD. Thank you, everybody. Thank you for staff for coming here. We're happy to have everybody here, and we believe Asaba Specialist Hospital will go higher and higher, and long live your Majesty. Umago. Umago. Umago.